Hello. Good evening, Dr. Joy. How are you doing?
I'm fine.
We're happy to have you here once again. So, Dr. Joy, we want to know what exactly is measles.
Oh, measles. Well, measles is a highly contagious viral infection caused by measles virus. It mainly affects children, but can occur at all ages. At all ages, yes. It presents with fever, cough, catarrh, and distinct rash known as macropapular rash.
Wow. So, Dr. Joy, please, what causes measles and how does it enter the body?
As I said earlier, it's caused by measles virus and is transmitted through respiratory droplets. When an infected person coughs or sneezes, the virus enters through the nose, the mouth, or the eye and spreads all through the body.
Wow. This is very interesting to know. So, how contagious is measles compared to other diseases?
Actually, measles is one of the most contagious diseases known. If one infected person in a room is having measles, up to 90% of unvaccinated people in the same room nearby can also contact the infection.
Wow.
They can get infected.
Wow.
Yes.
So, what are the early signs parents should always watch out for?
Okay, any signs parents watch out for include the high fever. The fever is usually high grade, cough, catarrh. The cough are usually persistent, running nose, red watery eyes, then small white spots in the mouth. We call the Copley spots. It's found at the level of the premolar.
Interesting.
Yeah.
That's very interesting to know. Thank you so much.
Thank you.
At what age does the rash appear and how does it spread?
Okay, the rash typically appears 3 to 5 days following the fever, and it usually starts from the face, especially along the hairline, and involve the ear, the neck, and later spreads towards the extremities, both the upper and lower extremities.
Interesting. It is safe to say that measles is a complex disease, right?
Of course.
Okay, so can measles be mistaken for other illnesses?
Yeah, many people. Yeah, it can be mistaken for other illnesses. The common malaria, as we all know that the commonest cause of fever in our environment is malaria. So measles can be mistaken for malaria and other diseases that present with rashes, especially the chickenpox. Yes, at times caregivers they find it difficult to differentiate between measles and chickenpox. That's why I can say it can be mistaken. But the difference there is the nature of the rash, the appearance of the fever, the day of appearance of the fever, and the appearance of the rash. It helps to differentiate the two. Like for the measles, the rash comes before the fever. The chickenpox, the rash comes before the fever. Unlike measles, the rash comes after the fever.
Wow, I'm wowed. I remember you said that it is most common in children.
Yes,
and their parents have to look out for some things. So how can the parents differentiate between measles and common fever or malaria?
Okay, it's common in children actually because of what their immune system is still developing, so they have high chance of contracting the disease. Then the way the parents could differentiate between other causes of fever and measles is one, when the fever persists despite anti-malaria medication or antipyretic medication. If it persists, and again, if there's persistent cough, redness of the eyes, yes, and the typical rash that is found in measles that follow the hairline, involving the extremity, known as the maculopapular rash.
Okay, thank you so much, Dr. Joe. People take measles very lightly, right? Yes. So what are the most common implications it can lead to?
Most common complications? Okay, the commonest cause of death in measles is pneumonia. Why the most common complication is ear infection we call otitis media. But there are long-term complications we call the subacute sclerosing panencephalitis. It's a long-term complication of measles that can affect an individual. It usually occurs 7 years following a measles infection. When there is a resurgence of the virus in the brain cell, it can lead to subacute sclerosing panencephalitis. They usually present with seizure. You see this person having recurrent seizure, having muscle stiffness, myoclonus, depending on the stage.
Thank you so much. So, Dr. Joe, you mentioned that children under the age of 5 are more vulnerable because of their undeveloped immune system,
yes,
right?
Yes.
So, and there are vaccines for this measles. Yes. How effective is the measles vaccine?
Oh, very effective. Measles vaccine, very, very effective. About 97% protection after 2 doses.
That's amazing. That's amazing. So, at what age should children receive this vaccine?
Okay, they will receive this vaccine 2 times. One at the age of 9 months as measles conjugate vaccine given on the left upper part of the hand, of the arm. Okay, subcutaneously. It's given at the left upper part of the arm. Then the second dose is at the age of 15 months or 15 to 18 months. That's when the child receives the second dose. given at the same site as measles conjugate vaccine.
But we are actually very confused. Why do we still see measles cases despite vaccination?
Oh, I agree with you. Yes, there are a lot of, I have a lot of reasons on that. One is missed vaccination. Yes, you see some people, despite the availability of the vaccine, they find it difficult to go to the immunization center to receive the vaccination. Then again, is the poor vaccine coverage is also another cause of that. Then again, is ignorance. At times, caregivers don't know about all this, and outbreak, and also outbreak in unvaccinated communities. It can result to measles despite vaccination.
Oh my God, we are really learning today. So what would you say to parents who are hesitant of this vaccination?
Okay, what I have to tell parents out there is they should know that vaccination, getting your child vaccinated for measles is safe, it's effective, and it's life-saving. The risks of measles are far greater than any vaccine that is concerned.
All right. That's amazing. That's amazing. Is measles caused by heat or certain foods?
No, this measles, as I said earlier, it has nothing to do with any form of meat or certain foods. It's caused by the virus. It's caused by measles virus, not diet or weather.
So I'm very curious. Can herbal medications cure measles?
No. Herbal medication, it has no role in curing measles. Because of what? It cannot eliminate the virus which is implicated.
That's amazing. So is there a specific cure for it?
No specific cure for measles. Treatment is usually supportive. There's no specific cure for it. Treatment is mainly supportive.
Okay, thank you, Dr. Joy. We believe you're a medical doctor. We would like to know how measles are being managed in the hospitals.
Okay, well, I will tell you that, as I said earlier, treatment is so supportive. One, you start by hydrating the child. Yes. Then to prevent the complication, you give some supplements, vitamin A supplements. It helps to reduce the morbidity and mortality that can follow the measles. Then we treat most complications that could arise. Like the one I told you that is the commonest cause of death, which is pneumonia. You have to institute therapy for pneumonia, depending. Then with supportive care, I think the child is good to go.
Okay.
And one thing you should know, it's one of the notifiable diseases. This measles, any child or any person that's having measles in the hospital, we isolate the person because of what? It's highly contagious. Yes, it's highly contagious. So it's one of the notifiable diseases and of public health importance.
Wow, I'm wowed. I'm wowed. I also want to ask, when should the parents rush to the hospital? When do you think it's okay?
For me, I always advise don't wait until symptoms or complication ensues. Once you notice any signs, any symptom, rush your child to the hospital. At some point, you see the parents, they'll be waiting when the child starts having difficulty in breathing, because the pneumonia can result in difficulty in breathing. Frequent vomiting, convulsion. Yes, measles is one of the leading cause of febrile convulsion in children. So please, we don't advise that the parents could wait. Once they notice the fever and any other complication, they should please bring the child to the hospital.
Thank you so much. So, doctor, you made mention that measles is of public health concern.
Yes.
I want to know, why is measles still a concern in Nigeria despite the treatment?
Okay, it's because of, as I said earlier, it's because of the less vaccination coverage, misinformation, and limited access for some people to healthcare facility.
Okay.
Yes.
So, in order to eliminate this, what role do you think community awareness would play?
Oh, awareness is very, very important. You have to sensitize caregivers, parents on this. Awareness can increase vaccination rates. Yes. And early detection, thereby reducing the outbreaks.
Wow. I hope our audience have learned a lot today. So, Dr. Jerry, one last thing. What advice can you give to parents and caretakers about measles?
Okay, one advice I can give them is they should protect their child before exposure happens. The protection I meant here is that 2 doses of vaccination the child is meant to receive at 9 months and 15 months. So they should protect their child. They should vaccinate the child early and act fast, and don't ignore any symptom. Once noticed, they should bring the child to the hospital.
Thank you. So it is safe to say that from today's lecture, we should ensure that our children are being vaccinated. We shouldn't ignore the vaccination, and we should take it as early as possible.
Exactly.
Thank you so much. I've learned a lot, not just the audience, and one of the learners. Thank you so much once again, Dr. Joy. We're happy to have you here, and we hope that we'll always have you here. Thank you for your time. Bye. Thank you.